We'll follow up. Thank you.
Thank you, Senator Ricketts. Commissioner, I want to start on the question of funding. I think one of the graphics that you, I should say the charts that you included in part of your material is headline, "Staffing Declines as Beneficiaries Rise." Kind of says it all. But as you made reference to as well in your testimony, the President requested $15.4 billion for the Social Security Administration for fiscal year 2025, which is a nearly 9% increase. For years, the administration, SSA, has been chronically underfunded, as I mentioned. Ultimately, this underfunding negatively impacts benefit delivery. Despite this, we've heard extreme proposals from some that Congress should consider cutting Social Security. I'll never support cuts to Social Security. I think that's a fairly widespread view. We know that it's a lifeline for Americans of all walks of life. This is a promise that we have to deliver on, and I'll continue to work to fulfill that promise. So I have two questions, two interrelated questions. How would flat funding, or even worse, a cut or cuts to funding impact the Social Security Administration and ultimately beneficiaries?
We are struggling as a big human resources organization where what we do is service. We're customer service. Our agents in the 1,210 field offices, the hardworking men and women that process claims at the Wilkes-Barre dock, it's all people. The technology, granted, some really, really old technology, by the way, still green screens and COBOL at the base of it. This puts me in mind of, back in governor days, Senator, if a school system, which is all, their budget is mostly all teachers in the classrooms, if they have fewer teachers and the number of students is rising, those classrooms are going to be larger. By way of analogy, if our staffing is fewer, our wait times are going to be higher and they're going to be longer lines. Sometimes when people have really, with really dire needs. So we have to get back, and the president's budget takes a really affirmative step at getting us back to the traditional 1.2% that we operated on prior to 2018, where we had a pretty high level of customer service. Nobody was, and it wasn't breaking the bank, and it was something that people had already paid for. If we were to receive the $15.4 billion proposed by the president, that would allow us, we believe, to reduce our 800 numbers hold times by 20 minutes. Currently 39 on average in the last fiscal year. We believe we can knock 20 minutes off of that. We'd be able to reduce initial disability claim wait times to 215 days, and we believe we can reduce the claims backlog by 15%. Another positive step in the right direction the following year would allow us to do even better. But we now are trying to serve the highest number of beneficiaries ever with the lowest staffing we've had in 27 years. And that has not been offset by huge investments in new technology and those sorts of modernization things. 90% of our technology budget goes to keeping old systems functioning rather than doing the upgrades that we need to.
I wanted to move to a second inquiry about the employees and morale and just those basic concerns that I think everyone has expressed over a number of years. SSA employees do great work, and just as you mentioned, in my home state of Pennsylvania, thousands of payments are processed each month. These payments are for retired workers and their families, people with disabilities, widows, widowers, children. Yet the number of beneficiaries grows, and staffing for SSA has hit a 25-year low. And by the end of fiscal year 2024, without any changes, staffing will be at the lowest level since 1972. Increasing workloads with limited staff inevitably results in higher levels of stress and burnout. This is causing problems for workers, applicants, and beneficiaries, leading to higher turnover, backlogs, and delays. SSA used to be ranked one of the best places to work, and now ranks at the bottom. So, Commissioner, you made reference earlier to this, but I wanted you to highlight it again or add to it. How are you engaging SSA employees? I know you've had a number of town halls and engagements like that. And what is your kind of broad-based plan to improve staff morale? And I know I'm over, but as soon as the Commissioner's done with his answer, I'll go to Ranking Member Braun.
Yeah, Senator, you kind of hit the nail on the head. 10 years ago, when we were able to operate on 1.2% of our overhead, we were rated as the best place in the federal government to work. Now we're dead last. The pressure that's being...
You went from best to last.
We went from best to last.
Yeah.
In fact, we've been last for 3 years in a row, and some people on the Fed survey vote with their feet by not even bothering to fill out the survey again. I've done 9 town halls with employees all across the country, not with set remarks, just more mayoral style, you know. And what I've felt and what I've seen out there is a workforce that is exhausted, they're stressed, they are overworked, the managers feel this pressure intensely as well. The sense that people don't care, that their workloads are just getting higher, none of their bosses listen, nobody in Washington listens. That morale problem then leads to all sorts of problems affecting the health of the workers, and if the workers aren't healthy, our customers do not receive good service. So here's a few of the things that we're doing. First and foremost, I've been present and I've been listening, and that actually is important. Some of the people in the town halls have said, you know, we just haven't had a commissioner that we could fuss at for so long. And some of the problems are things that you've got to believe when you're on the front line, that nobody in headquarters cares if they haven't fixed this by now. So we're fixing some of those things, and when we do, we let people know. We had 1,600 employees respond to the Engage survey that we did right off the bat. And there's one more thing that we're working on, and that has to do with, you know, when people ask for a reasonable accommodation because they have a sick child or they have some condition that requires that reasonable accommodation, that should not linger and take a year to resolve. So we're doing some reforms on that score as well. I meet regularly every month with the Labor Management Council. I encourage the regional commissioners to do the same thing, because the best ideas I ever received for improving customer service as a mayor or a governor always came from the people on the front lines doing the work at the MVAs or the other places. And now we have a system that actually listens to them and implements these changes.
I might just cut you off there only because we're over.
Yes, sir.
I'll go to Ranking